very grateful that you are here to do your health talks with our youth. And I'm going to turn it over to Dr. Chavez and let y'all introduce yourself. Thank you.
Oh, hi, everyone. My name is Eduardo Chavez. I teach child health at the University of Texas School of Nursing, and I'm here with a group of graduate students, and I will hand it over to them, let them introduce themselves, and then we'll begin our talk.
Hi, my name is Kavya.
Hey, I'm Abby.
I'm Ryan.
Kayla.
I'm Christina.
I'm Sandra.
Thank you.
And I'm Alexandra.
All right, is that everyone? Yes. All right, so I will hand it over to our two speakers, Kavya and Abby. It's all yours.
Awesome. So, hey guys, today we are going to be talking a little bit about lung disease. So I'm going to share my screen with you guys. And let's get started. Can you all see? Okay, cool. So like I said, we're talking about lung disease. So we can't talk about lung disease without first talking about the lungs. So this is just a quick little, or not quick, but kind of a simple overview of the respiratory system. So the most important things, well, you have your lungs, your mouth, and your throat. And so these are really, really important. These are organs and structures that allow us to breathe. So we need to exchange gases. That's what breathing is. So we take in oxygen and we exhale a gas called CO2 or carbon dioxide. And we need to keep a balance of these gases in order for our organs to work right. And so our lungs play a really important role in what we call gas exchange. So if you see my screen, I think I should be able to annotate. Right, so these little things over here that I circled, these are called alveoli. And so these are little sacs. They kind of look like clusters of grapes, and those actually sit inside of your lungs. They branch off of what we call bronchioles, which are the passageways that go into your lungs. And they actually fill up like little balloons with oxygen, and they allow for that exchange of oxygen and carbon dioxide that I mentioned. So these are really, really important. Now, oops. Uh-oh, I'm sorry. I need to, there we go. Uh-oh, I guess my circle is gonna stay there for the whole time. Oh no.
Okay.
Okay, no, I fixed it. Okay, so lung disease. Lung disease is an umbrella term that we use to describe any disease of the lungs. You know, it sounds pretty simple, but there are a lot of different types of lung diseases. So these are usually things that can occur, you can have irritation, so you might have allergies or some sort of foreign substance like smoke that gets into your lungs and can irritate those passageways, the bronchioles, or they can irritate the alveoli. Sometimes you have stiffening of the alveoli or narrowing of those passageways, and those are all different ways that you might get a lung disease. Those usually are a result of environmental chemicals. So I mentioned smoke, air pollution, things like that, especially if you live in more of a crowded urban area. Sometimes, you know, there's a lot of just different things in the air that you breathe in. And so over time, these can result in lung diseases that can make breathing difficult. But there are also lung diseases such as pneumonia, or now we know, you know, things like coronavirus that can affect your lungs in the short term. And so Kavya is going to talk to you a little bit more about the different types of lung diseases. Oh no, I'm so sorry. Okay, there we go. I'm struggling.
So lung disease, I think you skipped a slide, Abby. You have to go back one. There you go. So different types of lung disease. So lung disease, like Abby said, is a big term. It can mean so many different things, from lung cancer to just like asthma, which so many people, and I'm sure you have friends that are affected by asthma, or maybe you are, or your parents, or cystic fibrosis, which is another common thing where you get a whole bunch of like saliva and just like gunk in your lungs kind of. And then chronic obstructive pulmonary disease, which is COPD, which is a mix between bronchitis. I'm sure, have you heard of that? It's like a lot of coughing involved and emphysema too. And both of those combined or one of those can give you COPD. And then even infections just like the flu or pneumonia and so many more. And lung disease can look like a lot of things. It can look like shortness of breath, just like maybe getting up from your bed, walking to the kitchen and just being out of breath, or it can be shortness of breath after going for a little walk outside, or even just in general, just walking around in your home. It can be wheezing, which is when you're breathing, it kind of sounds like high-pitched squeaky noises, or frequent coughing, tightness in the chest. It can like hurt and just feel like it's difficult to breathe, or even just being super, super tired and just being totally exhausted from doing just your daily activities. And even like after eating, you can just be tired. And you can even sometimes see in some cases where your like lips and nails and toes can get bluish because it's difficult for oxygen to get all the way to the tips of some of your extremities. And then some risk factors for lung disease. So smoking is the biggest risk factor. This includes cigarettes, and it includes electronic cigarettes. So that means Juuls and vapes and pens and all those kind of things. I'm sure you've heard of them. Allergies are a big risk factor because sometimes can make it difficult to breathe with allergies, or long-term exposure to lung irritants like secondhand smoke, which we'll talk about in a little bit, air pollution, chemical fumes if you're working in like a factory, or just dust outside. And then age, biological sex, genetics. If you have a parent or grandparent who's affected by some sort of lung disease, you may have a higher chance of developing lung disease later. Environment, and being overweight, and illegal drugs like marijuana and smoking and that kind of thing. And then how can you avoid getting lung disease? The first thing would be don't smoke. And if you do smoke, or you know someone who smokes, try to get them to quit or try to quit. And there's a lot of resources online that you can find that can help with quitting smoking. You can try like a nicotine patch, or those nicotine gum and the nicotine gum stuff, and it kind of weans you off. You want to minimize your exposure to outdoor air pollution. I mean, now with us we're all wearing masks all the time for like city and state orders, but that's also helping us decrease our exposure to air pollution. We're preventing infection by washing our hands, avoiding crowds during cold and flu season, and getting the flu vaccine every year to avoid complications of the flu, or a even worse case of the flu. And you want to definitely, if you are at risk for lung disease, you want to talk to your doctor to see if you can get the pneumonia vaccine, because it's indicated for some people and not for others. And that's something to talk to your doctor about. And then you just want to exercise to keep your lungs healthy, and eat right, and make sure you're moving and getting that physical activity, like 30 minutes a day. And Abby's going to talk about this.
Yeah, this is something that I wanted to touch on, and Dr. Horton actually introduced me to this topic of third-hand smoke. So a lot of us may have heard of secondhand smoke, and secondhand smoke is sort of a mixture of the smoke that comes out of the burning end of a cigarette or cigar or whatever somebody is smoking, and the smoke that they breathe out. So this contains a lot of chemicals. It's got that nicotine, that tobacco, and all those other harmful chemicals that are in the cigarette or the cigar. And if a person who is not smoking breathes those in, they are also at risk for being affected by those chemicals. And so even if you don't smoke, secondhand smoke is actually a pretty significant risk factor for lung disease. Now, third-hand smoke is so the residual chemicals that are left behind on physical surfaces, not in the air, but like walls and clothes and furniture. And so this can be harder to avoid, especially if maybe you live with somebody who used to be a smoker or smokes. Even if they smoke outside, you may get it from their clothes. Or maybe if you live in an apartment building where somebody smokes or smoked in the past. And so both of these things can cause lung cancer and lung disease, even if you don't smoke, like I mentioned. So it's really important to try to limit your exposure. I understand that if you live with someone who smokes, it can be really hard to avoid second and third hand smoke. But as much as you can, try to vacuum carpets to get those chemicals out, wash clothes and drapes regularly. Try to avoid being in a really small space with someone who's smoking like a car or a small room, and just as much as you can, try to avoid that exposure. Now Kavya is going to talk to you about vaping real quick.
So now we're going to touch on vaping and lung disease. I know it's super common for teenagers and college students and a lot of young people to vape and own various different kinds of vapes, but people don't really realize how dangerous and addictive nicotine is. And it's really because it's so new in our society, and it's just such a new thing compared to like cigarettes that have been around for so long. There really hasn't been much research about it because we haven't really studied the long-term effects. So nobody really knows what the long-term damage what can happen in the long term to your lungs. And so, but to touch on what we do know, so nearly 400 people with rising numbers, this was as of a few months or almost a year ago, September 2019, and numbers are rising across 22 states have developed severe lung disease. And most of them were teenagers and young adults. And I know you've seen on Instagram and Facebook and stuff about these really young people holding up signs of them in like the ICUs of hospitals saying, this is what vaping did to me, and this is what having a Juul for 2 years did to me, and things like that. And it's really scary and it's really real. So symptoms, from what I read, symptoms started gradually with just like shortness of breath and like some kind of chest pain. And then it developed more and more into severe breathing difficulty and eventually led to hospital admission. And right now the FDA, CDC, and all state health officials and even hospital workers and doctors and nurses are really investigating these cases to determine the specific cause and how to prevent and treat them, or how to make maybe e-cigs be safer, or because right now we just don't know what goes into like a Juul pod. We don't know what's in it. There's over 30 or 40 chemicals in one tiny Juul pod, and you really don't know what you're inhaling, and it can be really detrimental to health. So why is it bad for you? Why is vaping bad for you? So nicotine itself has a negative effect on heart health and the circulatory system, which is like your heart pumping out blood to the rest of your body. It can increase your blood pressure, and an increased blood pressure can later on lead to a whole bunch of other problems. It can disrupt normal lung function, like I said, make breathing hard, and make like if you vape and you try to like go for a run, and you've been vaping for a couple of years now and you wanted to go for a run, it's going to be hard. It's not going to be the same as it was 2 years ago before you started vaping. And then it can have negative effects on your gum and teeth health. It can make it yellow, it can make it gross, and you're just not going to look that cute anymore.
So in terms of once a person has a lung disease, can we cure them? So it depends on the disease, but for the most part, no, there aren't a lot of cures for these diseases. A lot of the treatment is what we call supportive treatment, or just taking care of the symptoms that the person is experiencing. So a lot of the times if a person is having, say they have a chronic condition, so they have developed something like COPD that Kavya mentioned earlier, which occurs over time and can make it really hard to breathe. So they might be treated in the hospital with some oxygen and rest and just fluids and those supportive treatments. But sometimes if you have a condition like pneumonia that is caused by a bacteria that your doctor can actually find, then they can give you antibiotics for that. But for the most part, you won't get antibiotics for a lung disease unless you do have a bacterial infection that your doctor has actually tested you for. You won't get antibiotics if you have the coronavirus, or you won't get antibiotics if you have a condition like emphysema, because they won't help. Something like acute bronchitis as well, which can be bacterial or viral, they may treat with, cough medicine, but for the most part, again, those are just symptoms. Oxygen is mostly just supportive, and people mostly get that while they're in the hospital. The biggest thing you can do to prevent is to stop smoking. And if you don't smoke, then to reduce your environmental exposure to those pollutants that we talked about. And so what if you know somebody with lung disease? A lot of times we notice that lung diseases occur in our older populations. So maybe we know a grandparent with a lung disease or an older member of our community. It's not because they're old. Lung diseases can occur in anybody in any age, but as a person gets older, the tissue in their lungs gets weaker, we sort of lose some of those functions, and so they can be more likely to get a lung disease. But I just want to make sure you guys know that getting a lung disease isn't just a normal part of the aging process. So if you do know somebody with a lung disease, encourage them to eat frequent, healthy meals and eat with them, keep them company. When I say frequent and healthy, I mean small meals, a lean meat, some vegetables, but the reason they need to be frequent and small is because it can be hard to breathe if somebody has, chronic lung disease. It can make them really short of breath to try to eat big meals. And so let them rest before and after, even maybe during the meals if they need to. Make sure you're keeping them company, just offering that emotional support, letting them know it's okay. And keep them company during some light exercise. So going on a walk around the neighborhood, if they can handle it, could be really helpful. It is still important to exercise to keep the lungs working, but it is important to stop if the person becomes short of breath. So if they start having a harder time breathing, stop, sit down with them. And actually some things that you could do if you're with a person who gets short of breath is you can have them sit down in a chair with their feet flat on the floor and place their elbows on their knees and their chin in their hands like this. That can help. It can also help them to stand up and rest their hands on a piece of furniture or a bench or something in front of them. Sort of any leaned over position helps your chest expand a little. It helps you to breathe a little more. So if you are taking a walk with someone with lung disease, it can be helpful to know those things. And also to help keep their house clean. So I mentioned, vacuuming, cleaning drapes and clothes regularly. That can be really helpful. Dusting. Dust can be really irritating, even if you have asthma or just allergies. And then check for mold, because mold is also one of those things that can trigger things like bronchitis or allergies, or just really irritate the lungs of somebody with a pre-existing lung disease. And, try to remind them to take their medications or do their breathing treatments if they have them, and just overall be supportive. It can be hard to live with a chronic lung condition. It can be hard to live with an acute lung disease. And so it's just really important to be supportive, to make sure that to stop moving, if the person gets short of breath, and it's really important to be there for them. And so what we have for you guys now is a Kahoot game. I don't know how many of you, I see that we've had some people log in, so I don't know how many of you have ever used Kahoot before, but I am going to, let's see.
So go to kahoot.it on your phone or your laptop, really whatever you want. And then Abby's going to pull up the code that we type in. And then it's just a few, there's 4 questions just to go over our knowledge and what we've learned today.
So here we go. I'm going to host the game. And so if everybody wants to, okay, so go to kahoot.it and then put this pin in when it asks you. I'll give everyone a few minutes.
And let us know if anyone's having any trouble logging in or trying to access it. Yay, love to see so many people logging on.
I know, I'm excited. Nine. Okay, we'll give 1 more minute for everyone to log in.
It's a secret. Is there anyone else that's trying to log on that hasn't? Feel free to speak up.
If you could hear over the music. Oh, we lost someone.
Oh, we did lose someone.
Oh, we got someone
Oh,
else.
awesome. Secret too. Okay.
I love the creative names, Mount Zion Youth. Woo woo.
Super cute.
I know. Okay, I give it like, I feel like I saw a 12th person, so I'm gonna give it like 1 more minute. And like 20 more seconds. Okay, should we start?
Okay. Let's go ahead and start.
Okay, let's start the game. Question 1. Which of these is not a risk factor for lung diseases? So, using a Juul, having seasonal allergies, having a family member with a chronic lung condition, or getting a flu shot.
Oh, y'all are fast.
Nice.
Awesome.
Nice.
Oh
Awesome job, you guys. So you know that all these other things are risk factors for lung diseases, but getting a flu shot can actually help prevent lung disease that can be caused by the flu. Nice job. Next question. Ooh, Lindsay, first place. All right, question 2. Why is vaping harmful to your body? It can cause damage to your heart, can cause gum disease, it can increase your blood pressure, or all of the above. Nice.
Whoa.
You guys are paying attention. All right, next question. Lindsay, you're killing it. Okay. Question 3, true or false? Getting a lung disease is part of the normal aging process. That was fast. Nice. Awesome job, you guys. Makes me so
Wow,
happy.
Mount Zion Youth is smart.
Seriously.
Real smart.
All right, last question. Ooh, really Ryan's up there. All right, which of these is not considered a lung disease? So asthma, COPD, the common cold, or lung cancer? Nice. Okay,
Yay.
you guys did awesome. Look at that, 100% right on all the questions. That was awesome. Thank you so much for playing, you guys. That is the, well, here, let's see who came in first place.
Fourth, Kayla Longoria.
Second, Lindsay.
Oh.
Really, Ryan.
Really, Ryan.
Awesome, you guys. Let me see if I can go back over to the slides. I'm so sorry. I'm so not good with this technology thing.
There. It's on the left.
I see it. Okay. Okay, so that is about all of the info we have for you guys, and it's the end of our Kahoot, so we'd love to field any questions if anyone has any.
Okay, Mount Zion, you can unmute yourself and you can ask any questions for clarification. Or if you need, I don't know, you can just ask questions.
Yeah.
I have a question.
Sure.
Yes.
This is Kamora, by the way.
Hi, Kamora.
Hello.
I don't know if I missed this part or not, but how, I know this might be a dumb question, but how is asthma considered a lung disease? Like, isn't it just, I don't know. I just need clarification on that.
It's not a dumb question
No,
at all.
that's a good question. Kavya, I mean, I can, do you want to?
You got it.
Okay, so yeah, no, that's not a dumb question at all because we really didn't spend that much time talking about asthma. Asthma actually it's like when your body is really, really sensitive to certain what we call triggers, it's almost a really severe allergic response to certain things. But what happens is, so your bronchioles, which are like the passageways that go into your lungs, actually tighten, like in response to those things. So it could be like pollen or animal dander or something that you have a reaction to. And so it'll cause tightness in those bronchioles and make it really hard to breathe. And so because those are part of the lungs, it's considered a lung disease, but it's also like a really severe allergic condition. Does that make sense?
Yes, it does. Thank you.
Okay.
Also,
Yeah,
if
sure.
if you want to learn more about it, last week we had two of our peers that did a presentation on asthma, and it was really informative and really helpful. And I'm sure you've gotten the recording if you want to go check it out, or if you missed it last week. It really dives into in depth about that kind of stuff, and it kind of explains how it affects the lungs, and it was a really good presentation, and I recommend it.
Okay, thank you.
Yeah,
Thank you for that question. I was just going to let the Mount Zion youth know the recordings will be ready soon. I'm waiting just for them to be edited. And so we'll get them posted so you can go back and watch them. And if it's not too much to ask for Kavya and Abby to go back to the lung slide, just to have a visual of what the bronchioles look like with that tightness.
Yeah.
Oh, yes, of course. Oh, we don't really have bronchioles. Oh, yeah, we do. Sorry.
So I know it's kind of hard to see Gamora because it's a little bit of a like simple picture, but so yeah, so like this is what your bronchioles look like, and so those basically go through your lungs, kind of like this, and so they have all the little sacs like these at the end, and those are what fill with oxygen. And so if your bronchioles constrict, then you're just not getting enough oxygen to your little alveolar sacs down here.
Yeah.
Oh,
and
okay.
asthma is considered it's a chronic problem, so it's kind of there for your whole life since when you're diagnosed with it. So it's like that's also part of why it's considered like lung disease.
Yeah. Oh, okay. Thank you. That helps a lot.
Yeah.
Sure.
Of course.
Anyone else?
Okay, well, if you think of other questions, you can text them to Reverend Horton and he can get them to Dr. Chavez to get them to the students. I really appreciate you joining us today, and next Thursday at 3 p.m., the students will be going over cancer. Is that correct? Yes. So join us next Thursday for 3 p.m. cancer as it relates to young people. And Mount Zion, could you please thank the graduate nurses for taking time to share with us, pretty please?
Thank you so much.
Thank you. Of course. Thank y'all for joining us.
Yeah, thanks so much for coming.
It means a lot to us.
Thank you all for joining us.
Bye.
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 Thank y'all so much.
Yeah.
Like
Thank
Yeah,
you.
that was really good.
Oh,
it
good.
was really good. I think there was like four or five. I lost count. Was it like 4? So
yeah.
great. Thank y'all.
I'm glad that they joined, because when we first started, we had nobody, right? And then when Abby started speaking first, and then I was like, oh my gosh, someone's joining. And then I started speaking, even more joined by the end of that. So I was like, yes.
We did it.
Nice. I think the 3 o'clock is still cutting it kind of close, but I didn't want to push it back because some people say they don't log off with their classes until 3. And so I had a couple that got out at 2:30, but most of them said they got out at 3. And I was like, well, let's just do 3.
Okay.
And maybe next Thursday I'll send like a reminder right at 2:50 or something like that. Yeah. Well, thank y'all so much. I'm gonna go and if I can find my exit. How do I leave? Oh,
You
okay.
click the little leave
Bye,
the meeting.
Dr. Horton.
Bye. Thank you all.
Bye.
Bye, guys.
See you guys. Good job.
Thanks.
Bye.